Good evening, everybody. Welcome to Sexual and Health Education series. Today's episode is on high blood pressure and erectile dysfunction. What's the connection? Blood pressure, blood vessels, cardiovascular health, erectile function. So we will dive into the topic. Why blood flow matters? An erection is a neurovascular event. It depends heavily on healthy blood vessels. Sexual stimulation triggers signals that allow colon arteries to relax. Increased blood flow fills the erectile tissue and helps produce firmness. Anything that impairs vascular function can potentially affect erectile response. The vascular connection. How can high blood pressure affect erections? Persistent high blood pressure. So as you can see, 150 by 90 and above. Blood vessels dysfunction, reduced ability to dilate, erectile difficulty. ED may reflect broader vascular health. Hypertension and erectile dysfunction can share vascular risk factors. Persistent ED should not always be viewed as an isolated sexual performance issue. Depending on age and risk profile, assessment may include blood pressure, glucose, lipids, and cardiovascular risk. Sexual health evaluation can therefore be an opportunity to review overall health. So, indirectly, we can say that ED is not confined to sexual performance, it is also linked to other body issues such as cardiovascular. And in the previous video, we have explained about the other impacts of erectile dysfunction on other systems of the body. High blood pressure often travels with other risks. Diabetes or elevated blood glucose, abnormal cholesterol, overweight or obesity, smoking, physical inactivity, poor sleep, and other cardiovascular risk factors. What about blood pressure medicines? Some antihypertensive medicines may contribute to sexual side effects in some patients. Yes, this is seen in my most of the patients. So whenever a patient comes to my OP, I definitely ask him, what is the tablet you are taking every day? So not every blood pressure medicine affects erections the same way. Yes, there is a slight variation and it depends on the medication. Never stop, reduce or change a prescribed BP medication on your own. Some people does the same thing. This leads to cardiovascular complications. If sexual symptoms begin after a medication change, discuss them with the prescribing doctor. Don't blame the medicine too quickly. Hypertension itself can contribute to vascular dysfunction. Diabetes, cholesterol, smoking, obesity, stress, and hormonal factors may coexist. Anxiety after an episode of erectile difficulty can further worsen performance. The correct approach is individualized assessment, not assumptions. What should be evaluated? When did the erection problem begin? So, when did the erection problem begin? It should be noted down. Is the difficulty achieving firmness, maintaining it, or both? Are morning or spontaneous erections changing? What BP medicines and other medications are being taken? Are diabetes, cholesterol, smoking, or obesity present? Are stress, anxiety, sleep, or relationship factors contributing? So these must be evaluated. When should you consider a medical advice? Erection difficulty is persistent or recurrent. You have hypertension plus cardiovascular risk factors. There is noticeable change in firmness or erection maintenance. Sexual desire or spontaneous erections have significantly changed. The problem is causing significant personal or relationship distress. So today's take-home message: yes, high blood pressure can contribute to erectile difficulties. Erectile function depends on healthy vascular function, but ED is often multifactorial and deserves proper assessment. Never stop prescribed blood pressure medication without medical advice. Confidential, educational, professional. Continue your men's wellness education. Subscribe for evidence-based men's sexual health education. Complimentary 2-minute men's sexual wellness check is in the link in the YouTube description. Please go through it. Instagram at the rate sexologist _ Dr. Karthik. That is my account. DM men for self-check. Just type DM men for self-check. Education content does not replace individualized medical consultation. So this is important. So this is just for education purpose only. If you have the persistent problem, please consult the nearby sexologist. Thank you very much. That's all for today. Tomorrow we will meet once again.